Well, welcome back. This morning we are talking about menopause and hormones. All women will have different experiences. One big question is when to start and when to stop hormones. Dr. Patricia Gunner with the Austin Diagnostic Clinic just published an article on this topic and joins us this morning. Good morning to you.
Good morning.
All right, we've got the expert here with us this morning. So let's start off talking about when a woman should begin hormone therapy.
That's a difficult question because all women are different. But in general, as soon as women start having symptoms, if they're under the age of 50, they should probably start hormones.
Okay, so maybe not wait until it's just too much to bear.
That's correct. I see way too many people that were told they have to wait an entire year until they reach the definition of menopause before they can get symptom relief. But perimenopause can last 4 to 6 years easily.
What is the age range of when a woman hits menopause? And I'm sure it's a little bit different for everybody. I've always been curious about this.
Average age is 51. We consider anywhere between 45 to 55 to be normal. But there are a fair number of women that either because of hysterectomy or cancer chemotherapy agents go through menopause at a younger age.
Okay. Is it recommended for all women? Can all women turn to hormone therapy?
Not all women can, but the vast majority of women under the age of 50 can. The question comes up with women over the age of 50 and whether it's safe for them.
Okay. What about other herbal over-the-counter remedies for relief? Is anything, as good as this?
Nothing is as good as hormones.
Okay.
They all can provide women that have some mild symptoms with some temporary relief, but they're not as strong.
Okay, got it. You talked about this just a second ago when you mentioned risk. Do hormones increase your risk of heart disease, cancer? You hear a little bit about that when you're using hormones for other types of things.
Again, it depends on age. The younger you are when you start hormones, the less risk involved.
Okay.
We actually believe that they're beneficial for women in the 40s and younger to take hormone replacement because the average age of menopause is not until 51. And it does help to prevent early onset heart disease and osteoporosis as well.
Once you start hormone therapy, how long are you typically on it? How do you know when to stop?
We want to use the smallest dose for the shortest length of time possible, but unfortunately, we don't know when that is without stopping it. And so I generally, once a woman hits 50, talk to them about trying to stop and see how they feel. If they feel bad, we put them back on it. Maybe at a lower dose, but
yeah, I was going to say, you mentioned the lower doses. Sometimes you might start someone at a low dose and then up it a little bit as you go along if you need to.
We can. If we start it early before a woman has stopped having her period, then we may increase it when they actually hit menopause and then decrease it when they get older.
All right. Thank you so much for being here with us this morning. Great information, and we're going to have it all on our website with this interview on KXAN.com. Thanks for being here.
Thanks.